Hi, I'm a healthcare provider at Florida Heart and Vascular Multi-Specialty Group, here to share with you some tips on ways to maintain your health. If you thought vaccines were just for little ones, you will need to think again. As you age, you are at risk for many different diseases. So you might ask, what can I do to maintain my health? More than you can think. The flu, pneumonia, and shingles vaccines are preventative. They provide one aspect of health maintenance and are an important part of you staying healthy. They work with your body's natural defenses to help you develop an immunity that can reduce your chances of getting these diseases and also reduce your chances of complications. Infants, older adults, and people with weakened immune systems, like those undergoing cancer treatment, are especially vulnerable to infectious diseases. Some adults incorrectly assume that vaccines they received as children would protect them for the rest of their lives. Even if you were fully vaccinated as a child, the protection from some vaccines you received can wear off. The specific vaccines you need as an adult are determined by factors such as your age, lifestyle, health conditions, and plans to travel. So why vaccinate? You may be at risk for serious disease. You can protect yourself and your loved ones from certain diseases. You can't afford to risk getting sick. Better vaccines may be available, or your work may require it. 3 of the most common vaccines for adults include those which have been developed for flu, pneumonia, and shingles. When it comes to flu vaccines, the rule of thumb is simple. Everyone needs a flu vaccine every year. As an adult, the flu vaccine may reduce your risk of influenza-related heart attacks or other flu-related complications, especially if you have existing health conditions like diabetes or chronic lung disease. Although it may not prevent all strains of flu, it's worth getting, especially if you have a chronic health condition, are pregnant, or older. New flu vaccines are released every year to keep up with the rapidly adapting flu viruses. Because the flu viruses evolve so quickly, last year's vaccine may not protect you from this year's viruses. Additionally, antibody levels from flu shots start to decline over time, another reason to get one every year. Because the flu vaccine is produced by private manufacturers, its availability depends on when production is completed. Usually the vaccine is delivered to providers around July or August and continues to be shipped until late in the fall. Be sure to ask your Florida Heart and Vascular Multi-Specialty Group provider about getting your flu shot. Commonly, when you get the flu, you can be at greater risk for pneumonia. It's thought the flu virus weakens your immune system and allows it to be attacked by bacteria. Most people don't know that in the US alone, more people die from pneumococcal diseases each year than all other vaccine-preventable diseases combined. The pneumococcal vaccine can prevent serious blood, brain, and lung bacteria infections, which include pneumonia, meningitis, and septicemia. Today, there are 2 different types of pneumococcal vaccines. One protects against adults. The other, which has in the past been routinely given to infants and toddlers, has now been approved by the FDA for use in adults 50 and older. The first pneumococcal vaccine can be given to you at any time of the year. The second, called pneumococcal polysaccharide vaccine, which is often referred to by its brand name, Prevnar 13, is recommended if you are 19 or over and have a medical condition such as kidney disease, chronic heart and lung conditions, sickle cell disease, or a condition that causes a weakening of your immune system. Your doctor can help you determine which pneumonia vaccines are right for you. A lot of TV commercials and magazine ads recently focus on shingles, a painful skin rash caused by the same virus that causes chickenpox. The shingles vaccine contains a weakened form of the chickenpox virus, which helps your immune system defend against the disease. This vaccine can roughly cut in half your chances of getting shingles, and if you've already had shingles, may help prevent the disease from coming back. It may also reduce the period of shingles-related nerve pain, a condition that can last far beyond the rash. Talk with your Florida Heart and Vascular provider if you think you would like to be vaccinated against shingles. Lastly, let's talk about booster shots for tetanus and whooping cough. Just because you had a vaccine when you were younger doesn't mean you remain fully immunized against the disease. Booster shots may be appropriate for adults for these diseases, especially if you spend much time around your grandbabies and children. When it comes to vaccines, keeping up with yours is just as important as an adult as it was when you were a child. Remember, talk to your Florida Heart and Vascular provider at every visit to make sure yours are all up to date. Thanks for watching these smart tips on ways to stay well.